Hello, I'm Dr. Michelangelo Austin. Welcome to today's Bite-Sized Bit. Today is an important one because it is the connection between the mouth and the body. And so the first thing I want to start with actually is diabetes. Diabetes, a lot of times the medical doctors will tell you to get your feet checked and to get your eyes checked, and it's not really because they can cure the problems that you're having, but mostly just to help you cope better with the disease. But if you're not getting your mouth checked, if the inflammation process is active in your mouth, say from gum disease, then what happens is that you have a really difficult time controlling your blood sugar. So by actually getting the gum disease in your mouth and the cavities taken care of, you can fight the inflammation process and you can help overall to control your blood sugar when you're a diabetic. For heart disease, there's a lot of bacteria that live in our mouth that actually colonize the heart. And so what happens is that if the bacteria is really built up in your mouth and it gets into your bloodstream at all, it can actually colonize some of the flaps on our heart and some of our blood vessels, and it can cause heart disease and give us a lot of problems there. The American Geriatric Society published a study that said that patients that don't brush have a 65% higher likelihood of developing dementia than those people that actually do brush on a regular basis. When you look at stroke, the American Journal of Medicine published a study that says those who brush their teeth on a regular basis and take care of their mouths better actually have a decreased risk of stroke. All right. Respirator diseases. Now, this study was done by the Journal of Periodontology, and they were talking about if you get your mouth clean, what actually happens is that you have a decreased risk of developing COPD, and there's also a risk of respirator diseases like pneumonia that can actually be caused from some of the bacteria that live in our mouth. I want to take a moment and talk about healthy babies. Ladies, you have to listen. When you're pregnant, whatever culture is in your mouth, your baby is going to be inoculated. So, a lot of times people come in and they say, I have horrible teeth and it's bad in my family. And I say, yeah, you're right. It's about 30% genetics, 70% environmental. And so what happens is that, when you're feeding your baby, if your mouth is not clean, actually what happens is that you inoculate the child with whatever bacterial culture is in your mouth. As a mother, you give it to the child. And it takes, it takes a couple of years to establish a culture, but then once it's set up, it's really, really difficult to change. And so, you can spend your entire life having it help you by having a really good bacterial culture and keeping the kid's mouth clean and your own mouth clean as a mom, or, it can hurt you. And if you're not keeping your own mouth clean and taking care of your own mouth, then your children are actually going to be affected. And so it also, there's been some studies that publish that women that have healthier mouths actually have, easier deliveries and healthier babies. When you turn 65, like I've said before, when you're an adult, your number one cause of tooth loss is from gum disease. And so, a lot of times when you're 65, you lose your insurance, and all these years your insurance company has convinced you that you just need a regular cleaning, and essentially you've kicked the can further down the road by not treating your mouth appropriately. And so what happens is that you lose your insurance, and then by them not having you do treatment, that's how an insurance company would make money, obviously. But what happens is that they drop you when you're 65, or you retire and you get rid of your insurance, and then essentially you're left holding the bill. And when you're 65 and you have gum disease, heart disease, by having gum disease at the age of 65, I mean it's a huge indicator that somebody is going to have heart disease as well. There's a major link there. In guys, erectile dysfunction, there's some studies starting to correlate to, having an unhealthy mouth with erectile dysfunction, and that's just because of all the bacteria that are in our mouth. And I always say, if your breath is bad, and you're married, I mean, basically, you can forget about kissing your wife, forget about anything else that's going on. And so the point is that, as a woman, look, if the guy lays down in bed and you can't tell if it's the family dog or your husband, probably he needs to get evaluated for his bad breath. And actually, there's some studies that show 90%, if you have bad breath, 90% of all the people that have bad breath can be cured just by having their mouth treated, okay? Only about 10% comes from things other than your mouth, your bad breath. And so it's fundamental. I mean, if you want to interact with people, and really I always think, like when people are, when they're doing their daily professions, I mean, it's extremely important how you interact with each other, and you can't have, black teeth and bad gums and bad breath and all these things that are occurring when you're out and about dealing with society. I mean, it's very offensive. And guys, I'm telling you, because it's especially offensive to women. This last one is on more of a serious note. Radiation and chemotherapy. It is critical that you get your treatment done before you go into radiation or chemotherapy. And then if you're having chemotherapy, and especially if you're having radiation to the head and neck region, or if you know somebody that's going through it right now, they absolutely need custom fabricated trays with fluoride. And what happens is that I make the trays in the office, and any dentist, I don't care where they're at in the country, like get them into a dentist. What happens is that the fluoride goes into the tray, and then the patient sits with that for 10 minutes in their mouth a day. If you're going through these kind of serious treatments, there is no home health care that you can do that would be enough to combat all the damage that's going to be done to your mouth by going through these necessary treatments. It's just that there's so many complications that occur from them, or things that happen, that it's just imperative that you get in and you receive the trays, because it's going to save you so much work and so much pain, and possibly, almost definitely losing some teeth. So anyways, this is Dr. Michelangelo Ost with Modern Family Dentist, and I hope you enjoyed today's bite-sized bit. I'll see you soon.